Today we will be discussing oncology. The purpose of this lecture is to give you a general view of the pathology of cancer and different treatments. You will have more elaboration on various types of cancer in your Med-Surg 3 class. Cancer is a disease process that begins when the cell is transformed by genetic mutations that are either inherited or acquired of the cellular DNA. Here are some terms that you need to know. You need to look at the beginning of your chapter and write down any terms that you do not know. You are responsible for all of them that are listed here. Some ones that are especially important include carcinogenesis, which is the progression of normal to malignant cells. Neoplasia is uncontrolled cell growth. Thrombocytopenia is decreased platelets. And TSA is a protein that distinguishes malignant from benign cells. Chemotherapy is the use of medications to kill tumor cells by interfering with cellular functions and reproduction. Radiation therapy is the use of ionizing radiation to kill malignant cells. The cancerous disease process is when normal cells are converted to abnormal cells by a genetic mutation in the DNA. Metastasis is when these abnormal cells invade other tissues at a quick rate. We have a visual of that on the next slide here. The differences between malignant and benign tumor are as follows. A benign tumor typically has a better outcome than a malignant tumor. Because malignant tumors invade neighboring tissues, other blood vessels, and metastasize as different sites, as seen on the right hand of this slide, essentially it spreads. On the other hand, a benign tumor, not cancerous tumor, does not have the tendency to spread. The malignant process includes cell proliferation, which is uncontrolled growth with the ability to metastasize and destroy tissue, as you just saw a visual of that, and cause death. Cell characteristics of malignant cells include the presence of tumor-specific antigens, or TSA, altered shape, structure, metabolism, and evasion of growth suppression signals. Or another way of saying that is very quick growth. Here are the three ways that malignant cells spread. The first is lymphatic spread. Lymphatic spread is the most common way that malignant cells spread in interstitial fluid, lymph nodes. Hematogenous spread is malignant cells spreading in the bloodstream, and this is not as common because malignant cells can get damaged in blood vessels. The third is angiogenous spread, which is malignant cells spreading by creating new blood vessels. This helps malignant cells grow by getting nutrients and oxygen in the blood vessels. Here is a list of the carcinogenic agents and factors that can be cancer-causing. The first includes viral and bacterial infection, which causes 20% of all cancers. A viral infection that can lead to cancer happens by a DNA virus inserting a part of their own virus into the DNA that causes cell division. An example of this is HPV, or human papillomavirus, a bacterial infection that can become carcinogenic. An example of that is H. pylori that we just learned about if left untreated. Physical factors that can be carcinogenic include sunlight, radiation, and chronic irritation. Chemical agents include tobacco, such as in smoking, or asbestos. Smoking is one of the leading causes of cancer in the United States. Genetic or familial factors can be carcinogenic as well. For example, colorectal or lung cancer. Diet can be a risk factor as well. Foods that would decrease the risk of cancer include fruits, vegetables, and baked meats. Foods that would increase the likelihood of one developing cancer include fats, alcohols, and smoked meats. Hormones can be a cancer-causing agent as well, either the body's own hormones or by administration of hormones. For example, prolonged estrogen therapy increases the risk of breast cancer. So we are going to focus on two types of prevention. The first is primary prevention, which is risk reduction, and secondary prevention, which is detection and screening and early diagnosis. Primary prevention is all about education, encouraging our patients to avoid known carcinogens and to make lifestyle and dietary changes to reduce the risk of cancer. In fact, 75% of all cancers in the U.S. are related to environmental and lifestyle factors. Secondary prevention includes identification of patients at high cancer risk and screening these patients by self-breast exam, self-testicular exam, screening, and a colonoscopy, a Pap test. If one of your patients is exhibiting any of the warning signs that are listed here, it is important that they see a provider to follow up on this. So make sure that you know this list of warning signs. Here's a list of diagnostic testing for oncology patients. This is a self-study if you are not familiar with these tests that are listed. I will mention that the PET is the use of a tracer providing an image of the biologic activity of a particular area rather than its structure. Here's the tumor staging and grading guide. This is typically done for each type of cancer. Staging includes T, the extent of the primary tumor, N, the absence or presence and extent of regional lymph node metastasis, and M is the absence or presence of distant metastasis. Grading is 1 to 4. The grade 1 tumors closely resemble the tissues of origin. This is less aggressive and less worrisome. Grade 4 tumors do not resemble the tissue of origin, and this is more aggressive and at this point less responsive to treatment. Management of cancer is going to vary depending on the type of cancer, stage, and grade of cancer. Cure would be to completely eradicate the tumor or malignant disease. Control is containment of cancer growth. This can be seen in more advanced cancers when radiation or chemotherapy can help slow the cancer progression and control symptoms. Palliative is, as it sounds, relief of symptoms associated with the disease and improvement of quality of life. For example, cancer can block the bowel, and a palliative management intervention would be to have surgery so that the patient has a colostomy. Management of cancer includes diagnostic surgeries. The first is biopsy, which is the gold standard for cancer diagnosis. And this is used to obtain a tissue sample to analyze to see if those tissues are in fact malignant. Excisional biopsy is the removal of small, easily accessible malignant cells. Examples of this are the skin, the breast, GI, and respiratory. Incisional biopsy is when the tumor mass is too large to be removed. So, a wedge of tissue is removed for analysis that contains malignant and benign cells so that they can be compared. Needle biopsy is removal of suspicious tumor mass of malignant cells that is safely and easily accessible. For example, the liver, lung, or kidney, and this is usually done with local anesthesia. Tumor removal is done with the goal to remove the entire tumor. Local excision is removal of the entire tumor and is usually done on an outpatient basis. Wide excision is removal of the primary tumor and surrounding tissues that are at high risk for tumor spread. This excision includes malignant and benign cells so that they may be compared. Prophylactic surgery involves removing non-vital tissues or organs that are at increased risk for developing cancer. Something that was in the media a couple years ago is when Angelina Jolie decided to have a prophylactic mastectomy when it was found that she had the BRCA1 gene, which is indicative of breast cancer. And that is an example of a prophylactic surgery. Palliative surgery is when surgical cure is not possible and the goals of surgical interventions are to relieve symptoms such as the colostomy that I previously mentioned. Reconstructive surgery may be indicated for breast, neck, head, and skin cancers after curative or radical surgery. Radiation therapy is the use of ionizing radioactive force to kill malignant cells in a targeted area with direct alteration of the DNA of malignant and normal tissues in that area. It can be curative, controlling, or palliative, as previously mentioned. External radiation occurs after a 3D image has been taken of the patient, either a CT, an MRI, or a PET scan of the area of concern. In external radiation, a radioactive beam is aimed at that area. This radioactive beam includes highly charged electrons. Internal radiation is radioactive seeds or beads being swallowed by the patient or placed into a body cavity such as the vagina or abdomen. Radiation reactions include a loss of skin integrity, hair loss. Effects on the GI system include nausea and vomiting, anorexia, and diarrhea. Effects on the bone marrow include thrombocytopenia, which is decreased platelets. Systemic effects include fatigue, malaise, and anorexia. Xerostonia is dryness of the mouth that patients can experience, and stomatis is inflammation of oral tissue. Alopecia is hair loss. Patients can experience leukopenia, which is a decreased white blood cell count. If this is the case, the patient is put into neutropenic precautions, which is reverse isolation that actually protects the patient. Some common neutropenic precautions interventions include no fresh fruit, boiled water, no flowers, no children, and no one with infection to help protect them with their decreased white blood cell count. In addition, it is important to look at skincare for the patients, make sure that we're assessing skin breakdown, turning our patients, giving them good oral care. We also want to make sure that caregivers are protected. We want to analyze the time, distance, and shielding in regards to these patients. Patients typically have a private room. There is a notice about radiation precautions outside of the room. No pregnant staff. Double gloved hands. And the caregiver is typically asked to limit their time with the patient, cluster their care, and to be 6 feet from the radiation source if possible. Chemotherapy is a drug used to destroy cancer cells by interfering with the DNA and cell replication of malignant cells. Chemotherapy can be curative, controlling, or palliative. Types of chemotherapy agents include, there's 2 medications we want you to know that are often tested on NCLEX. The first is Floracil, Floracil, and that's called the trade name is 5FU, and that's for colorectal cancer. Another one we would like you to know is Paclitaxel, Paclitaxel, or the trade name is Taxol for breast cancer. Adverse effects of chemotherapy include nausea and vomiting, diarrhea, constipation, and ulcers in the mouth. Chemotherapy is preferably given through a central line because it is a vesicant. If there is an infiltration, you need to stop the medication and make sure that you call the doctor and administer ice or heat depending on what kind of chemotherapy agent it was. Impaired skin integrity is one of the leading causes of infection for oncology patients. It is important to assess for infection by looking at temperature and white blood cell count. In addition, patients can have impaired oral mucosa, imbalanced nutrition, pain, anxiety, altered nutrition, and altered body image. Wigs, assisting with basic beauty, hygiene, and spiritual care can help with patients' altered body image. Hospice is a comprehensive multidisciplinary approach to the care of patients with terminal illness and their families. Death is usually within 6 months. It provides relief from pain. It can help quality of life and psychosocial and spiritual care.